Greetings, my name is Michael McKibben. I'm a chiropractor and I want to talk about whiplash injuries causing spinal misalignment. They were a topic of my 1960s chiropractic education in the USA. As reflected in this graphic, student chiropractors heard a typical story of a post-whiplash patient who was an occupant of a stationary car which was rear-ended by a speeding vehicle. Immediately and uncontrollably, bing, bing, the head goes back and forward 10 to 12 pound and carrying the neck, vertebra and discs well beyond their normal position and range of motion, causing a loss of normal alignment. We were taught that side-on X-ray views of the neck are needed to display possible loss of normal alignment. We learned to palpate the motion of the joints of the neck to check for chronic loss of normal joint movement. That sounds pretty logical. But medical practitioners cannot see a loss of normal alignment if they follow the Australian State Insurance Regulatory Authority guidelines, which restrict X-ray studies to relatively few post-whiplash patients who have indications of serious nerve damage or possible fractures. So the rest of them, they don't take X-rays. According to their guidelines, the mainstay of management for acute whiplash associated disorders is the provision of advice, encouraging return to usual activity and exercise. Limiting the nation's GPs to advice and encouragement denies thousands of post-whiplash patients discovery and management of a loss of both normal alignment and normal joint movement. No imaging of thousands, many thousands of post-whiplash patients has for 50 years left both the GP and the patient unaware of spinal distortions linking interference to their nervous system and ongoing symptoms. Harking back to my student days, we learnt that a spine's key role is to house and protect both the spinal cord and the nerves that emit from it. Decades of loss of ideal spinal position and movement may interfere with the function of the nervous system. Our one spine related nervous system acts as a structure conveying messages from tissue cells to the brain and from the brain down to the tissue cells. For easy display of one spine related nervous system, two charts are used. In my experience, disruption to the nerves supplying the musculoskeletal system often create ongoing back and or neck pain and or headaches. I've cared for patients whose loss of spinal alignment seem to have upset their self-regulatory autonomic nervous system, affecting various organ dysfunctions. Post-whiplash patients who have received medical management without discovery of their loss of ideal spinal alignment and who share continuing health problems are typical of patients who later seek chiropractic care. Now, the point of this video is, do you know someone who is one of those patients? If yes, please network this video to them. Drive safely, keep your eye on the rearview mirror. See you on video 4. All the best.